Welcome to the first Healthy Built Environment online forum webinar plus discussion session. This webinar series is a part of the newly launched NCCEH Healthy Built Environment in Canada online discussion forum. My name is Tina Chen, and I'm an environmental health and knowledge translation scientist at the National Collaborating Center for Environmental Health. So the format of this webinar is slightly different from most webinars you're familiar with. So instead of a monologue by a presenter for most of the hour, the presentation portion will only be about 30 minutes. So during this time, you can type your questions into the chat box on the lower right-hand side of your screen. After the presentation, we will have a discussion portion for about 30 minutes in which we will go over your questions and comments in the chat box, and you will also be able to ask your questions verbally via the teleconference line. And following the question and answer period, Charito and I will post the discussion questions that were shared in the event invites to the group. So I hope you have all reviewed and have had a chance to give the questions some thought. As this is our first webinar session, it will be a learning process for us, and we will make improvements as we go. We will disseminate an evaluation survey at the end to gather your feedback, and we would appreciate it if you could help us fill it out. So just a question came in, is there an option to get audio over the internet? Unfortunately, there isn't. It's only via the telephone at this point. We could look into using an internet in the future, but right now it's only by phone. So the session will be recorded and posted on the discussion forum where you can continue the conversations and connections there. So our presenter today is one of the moderators on the Healthy Built Environment Forum. Charito Gailling is a project manager at the BC Centre for Disease Control and on the population and public health team. And she will talk about the second edition of the BCCDC Healthy Built Environment Linkages Toolkit, which was published earlier this year. Charito supports provincial initiatives to promote healthier built environments with a web of allies within regional health authorities, community planning and local governments, academic researchers, and community-based organizations. She coordinates cross-sector learning and collaborations, including the BC Healthy Built Environment Alliance, and leads efforts to synthesize current research on the relationships between population health impacts and community planning. Thank you, Charito.
Thank you, Tina. Hi, everyone. It's such a pleasure to be able to speak with you this morning. As Tina mentioned, I'm Charito Gailling. I'm with the Provincial Health Services Authority here in BC. I'm a project manager with BC Centre for Disease Control, and my focus area is healthy built environment. I'm going to be speaking to you today about the Healthy Built Environment Linkages Toolkit. I'm just going to walk you through it as a framework for how we talk about healthy built environments. But before I get started, I just wanted to acknowledge the land on which we're calling from. Tina and I are situated here in Vancouver, BC, and we're within the traditional territories of the Coast Salish peoples. This includes Squamish, Tsleil-Waututh, and Musqueam nations, and we are extremely grateful to have the opportunity to work within this territory. I was laughing with Tina. I just want to mention that the photo you see of me on the slide there, I'm actually wearing the same exact dress today, just by coincidence. So you can imagine me looking exactly like that as I talk to you. So our goals for today is I'm going to talk about how the Linkages Toolkit came to be when it was first released in 2014. I'm going to review the tools within the toolkit and explain some examples of how each of them are used. And I'm going to talk about some enabling factors that support healthy built environments in BC. And I'm going to try to go through it pretty quickly because I'm very interested in your discussion questions. And as Tina mentioned, this is the first webinar that we've had as part of the National Discussion Forum. So we're trialing this format, but we're hoping that there's a lot of focus on discussion, not just with us and you guys calling in, but also between you. So we'll be also looking to learn from you as well as we move forward. So this next slide, some of you have seen this before, but I really like it. It's from the Canadian Medical Association, and it's a visual breakdown of how what makes Canadians sick and what makes us healthy. And you'll see that 60% of it is related to social determinants of health. And here in this slide, they call it your life and your environment. So we combine those both to talk about 60%. And so what I like about this slide is it really shows how social determinants have a larger impact on individual and population health than the healthcare system. And what we can learn from that is that any actions we take to improve population health and health inequities must address these social determinants and their impact on our daily lives. So those are very complex things, like you can see there. Income, early childhood development, social exclusion, civic infrastructure. And it depends on cross-sectoral coordination to be able to meaningfully address these complex issues in our public life. So as an overarching necessity, our work in healthy built environments is to encourage and support cross-sectoral collaboration, especially between local governments and private sector planners, developers, health professionals, and academic researchers. So we consider ourselves only one piece of the pie as health professionals. And I wanted to mention that we did a National Collaborating Center for Determinants of Health webinar 2 months ago, and we polled the audience. There was about 300 people in that one, mostly from health sector. And we learned really happily that over 62% of the audience regularly collaborate with other sectors on healthy built environment initiatives. So we were really pleased with that. So that's definitely happening in Canada. This next slide is just in case you're not familiar with the health system in BC. It shows that we've got 5 regional health authorities. Those are the lists on the right there. And I'm part of one of the province-wide health authorities. I'm part of Provincial Health Services. We also have a First Nations Health Authority here. And I wanted to share that within the regional health authorities, there are built environment teams in each of them. They vary in size, and they're situated within environmental health services. But the role of those environmental health officers is primarily to interact with local governments, to support and give input into local planning processes, to give the health input. And then my role within provincial health is to support overall coordination of healthy built environments in BC. And I also provide secretariat support for the Healthy Built Environment Alliance, which, as you'll see here, it's an alliance, a cross-sectoral alliance of over 150 members now. We pull together folks from health, planning and design, academic institutions, and nonprofit organizations. And then there's a smaller core group of about 25 member organizations that come together to form a more active steering committee. And those 25 member organizations are, they're more actively involved in decision-making for the alliance, as well as actual projects and collaborative efforts. So the Linkages Toolkit came out of this Healthy Built Environment Alliance. They envisioned it, and they continue to oversee its development as a living document. So the Healthy Built Environments Alliance, I just want to mention a couple of things what we do there. We coordinate opportunities for relationship building and knowledge exchange. So we have a speaker series. Every 3 months, we offer presentations and discussions with content experts, and that's open to anyone that wants to call in and join that. We have an email distribution to share information and resources related to the built environment. And then we support active collaborations with project management, which is my role. So that includes the Linkages Toolkit. So what is the Linkages Toolkit? Excuse me. As I mentioned, the Healthy Built Environment Alliance, one of the key functions it plays is to bring together diverse stakeholders. The other function is to collect and synthesize current research and evidence-based key messages on how community planning and design influence health. And so that's a mouthful. But the instrument we use to do that is the Healthy Built Environment Linkages Toolkit. So it's a document we keep updated every few years. We add new emerging areas of research. We refresh the content, and we add new sections that are prioritized by our stakeholders. It was last refreshed in April this year, and it includes new show you. But the most common way people use the Linkages Toolkit is just as a conceptual framework to start conversations about healthy built environments. So it lets people define what we mean when we talk about what is a healthy built environment, what are the key planning principles that enable healthier built environments, and what are different roles within different sectors that support our healthy built environments. It was first released in 2014, and it includes various tools within it to support new users who are newer to the concept, and then people that are more experienced and want more detailed data and being able to dig deeper into the research. So as well as a conceptual framework, it's also a quick reference to general planning principles of good planning and design that are broadly supported by health research, and those are the fact sheets. It also includes a roadmap, a visual roadmap, to research findings which associate specific planning and design interventions to various health outcomes. So that, as you'll see, those are the health evidence diagrams, as well as the summaries of diagrams. So I'll walk you through each of those things. I wanted to say that the toolkit's become widely accepted as a framework for healthy built environment, and it is currently used across Canada and internationally as a foundation for new resources and the development of presentations and training modules and things like national discussion forums. And so people use it not as a framework to develop other related tools that are specific to their context. Please feel free to interrupt me with questions on the chat box to Tina as they come up. I'm totally okay with that.
Oh, there was a question that came in about your first slide. Lisa said, I have seen this slide before, or this image before, but wonder if it works against our efforts to see improvements to the built environment through civic infrastructure if this only has a 10% impact on health. I'm wondering how to respond to this potential limitation.
Yeah, that's a really good question, and that's kind of why we combine the two, the 50% of your life and the 10% of your environment into, we consider those combined as the social determinants. And, you know, the built environment has such an impact on things like social exclusion, access to nutritious food, housing, homelessness, community belonging. Like, I've just recently contacted the Canadian Medical Association to see if they're planning to update this slide, because it's pretty old now. I think it's 2009. And the study that it was based on is close to 10 years old. So I totally agree. We need an updated slide. And I haven't heard back from the medical association, so I'm not sure what their plans are. But yeah, I also have criticisms around that. It's negatively framed. Yeah, and I think it could be more modernized. So thank you for that. I agree.
Yeah, I agree. So there's another question. I noticed that business is not one of the stakeholders. Do you see that they have a role, or how do you engage them? Industry, I guess, private.
Yeah, like local businesses.
Yeah.
Yeah, totally. We haven't identified those specifically in our the quadrants of stakeholders visual, but I would say as a provincial alliance, we function more high level. Like we target more provincial scoped partners, but at the local level, definitely that's happening within regional health authorities. And that would be an interesting conversation to come back to. I wonder if folks on the line are already partnering with local businesses and how, because that's definitely a valuable partnership there. Thank you for that. Good questions.
And just to respond to another question, a PowerPoint will be shared as a part of the recording on the forum. So I will send out, or actually, if most of you are interested in the forum, feel free to visit it. We'll be launching it today or tomorrow, hopefully. And the recording will be posted there, and you can continue discussions there.
Definitely. Awesome. Okay, so I'll carry on here. I'm just showing a slide now to show the conceptual framework. So when I say conceptual framework, this is the 5 features, we call them, of the built environment that everything in the Linkages Toolkit is based around. So we're looking at neighborhood design, housing, food systems, natural environments, and transportation. And these definitely have interactions between them, but those are the 5 main components that we focus on. I also wanted to say that the toolkit, its purpose is to give a rationale for why it's important to think about the built environment suggestions and planning principles as a starting point to ask the right questions within your local context, but it's not a prescriptive set of rules. So we intend it to be adapted for different contexts and different priorities and different health concerns for specific communities, but it is a general overarching framework. This is the conceptual framework in more detail. You'll see the 5 features there on the left, and each of those features have 3 to 4 planning principles that are born out of the research. So we can show the evidence that each of these planning principles are related to specific population and individual health outcomes. So, for example, you see neighborhood design. The first planning principle is create complete neighborhoods through mixed land use. And there's a whole bunch of health benefits related to that. This past spring, when we updated the toolkit, we added these 3 new considerations of practice, and those you'll see along the top. And those are things that relate overall across all of the features. And they're included as textual, like key messages in the toolkit. And we're hoping that as we expand and keep this resource updated, we'll continue to add new considerations for practice. This is an example of one of the fact sheets. So you'll see that this is neighborhood design, and it goes through key messages that are born out of the research. I think there's some, oh, there we go. So the first planning principle is about complete neighborhoods, and this is examples of some of the key messages that are in there. So grid-based neighborhood designs increase physical activity and reduce vehicle use. Walkable land use patterns are linked to employment productivity. And so those are the general synthesized statement that we took out of collective research evidence from various fields of study. So how these statements have been articulated and framed have been very carefully designed. So we try to, as fairly as possible, represent various research from different sources. So this is the tool that's used for new users that just want like an overarching gist of what the health outcomes are. But if you are interested in the sources, we give that in the source for each of these statements is on an online tool that I'll talk about at the end of the presentation, but we are creating an online diagrams tool that will take you right to the source evidence. So if that makes sense, my point is that there's opportunity to just get a high level of collective evidence research, but also if you want the more details, we can point you toward the source evidence. And a lot of these statements are very sort of common sense and high level, but I think the value out of the toolkit is that it's evidence-based. So if something is in the toolkit, you can be pretty sure that there's strong evidence for it. This is an example of the health evidence diagrams taken from the transportation network section. So the first planning principle for transportation is use street designs which prioritize active transportation. And you can see in the top right there, it shows the full evidence diagram. And it's a little messy, but if you look through, you can see that there's weighted arrows that show that the strength of evidence between the planning principle of active transportation is strong, that we know that there's strong evidence that increased walking is related to active transportation, and also that social well-being is strongly increased when walking is increased. So there's a collective evidence base for each of those linkages. And then 2 other types of arrows. There's a moderate arrow, so the lighter gray arrow shows that there's moderate evidence, so there's some, but it doesn't make the grade for a strong link. That might be that there might be some conflicting evidence, or there might be not enough evidence. And then the new research area is one that we found that it was an emerging area that's still worthwhile to include, but there may not be the amount or the consistency of evidence there. So I hope that makes sense. Let me know if it doesn't. And then for the next slide, there's also summaries of the health evidence diagram. So these are pieces where we've just taken where the strongest research associations in the health evidence diagrams have been. We've summarized them in a simpler way. So you can, if you don't want to know exactly all of the links, just the strongest ones, you can go to this. And to assess the weight of all this research evidence and to figure out if the type of link is strong, moderate, or new research area, we have a grading criteria. So I can show you that if you're interested. It's quite rigorous, and the priority is on peer-reviewed systemic reviews. But we've also incorporated primary research and expert opinion into new research areas that we felt were still valuable to include. And, oh yeah, so this, I was mentioning there's some new pieces in the new toolkit. I won't go into this in detail, but we have tried to collect research on social well-being as a population health outcome, economic co-benefits, so that means cost savings to local governments and to health authorities, as well as to individuals and families where we could find it. And because our users were really asking for this economic argument, because they felt that would carry some weight with their decision makers. And then we also tried to collect evidence on rural communities, which we've termed small and medium size. I have to say we found limited evidence there, but we collected what we could and put together all the key messages into that section. So just some examples of how people use the toolkit. So as I mentioned, it's often used to frame conversations, events, training, and related resources. An example of that is Vancouver Coastal Health. A few years ago now, the city of North Vancouver was reviewing their official community plan, and so they held a series of community dialogues based on the Linkages Toolkit framework. They found that worked really well. They also had UBCM held a workshop, so and they used the toolkit as well to support those conversations. And we also try to loop back to health researchers to show those new research area links, the dotted lines, that these are opportunities for further research and to show them that this is where, there's some evidence to show this, but we need more to be able to really assert that these planning principles are linked to health outcomes with confidence. So we try to give that message back to health researchers that we need further research in these areas. And then in the bottom there's some examples of how it's been used in other provinces in Canada and internationally. So just some enabling factors. I made this slide because I wanted to show that there's different levels where healthy built environment collaborative groups and key partners are available at the local and regional level, at the provincial level. And then at the national level, there is, we do work closely with the National Collaborating Centers and the Canadian Institute of Planners, but we're kind of missing a gap there in the collaborative opportunity on the national level. And we're hoping that this Healthy Built Environment discussion forum will help address that gap. Previously, some of you were probably involved in the CLASP initiative, and that had worked really well. I wasn't there at that time, but that people say really good things about the outcomes of CLASP. So this national discussion forum is an attempt at pulling together a type of community of practice across Canada. And the interest in this webinar and in the discussion forum so far is really positive. So we're hoping that this will be useful for you to connect outside of your province. So next steps in the works, I mentioned briefly that those evidence diagrams, we're working right now with Emily Carr Design Lab to create interactive versions of it. So we would like to create some sort of online where you can click on the arrows and go right to the source evidence and click on a health outcome or an intermediate impact and come up with a synthesized key message that you can just cut and paste into whatever document you're using. So trying to make it even more accessible. We're also working with Children's Hospital to create a mental health and built environment fact sheet, um, which will have some relationships to the social well-being considerations of practice that are included in the toolkit. I didn't put it on this slide here, but we're also about to work on developing a conceptual framework for social environment. So the Linkages Toolkit was primarily motivated by to show the links to physical health, healthy built environment, and physical well-being. And we want to make a complementary framework that looks at social well-being, because we really found with looking at that piece in the most recent revision that there is such huge, enormous health benefits related to social connections and having positive relationships in the community. And we wanted to flesh that out a little bit more in the next resource that we'll be putting out. We're also working with TINA at the National Collaborating Center for Environmental Health to develop this national discussion forum, which you all know very much about. And this is the pilot year, so we're hoping that, as I mentioned, that this will develop into more of an established community of practice. And there's a bunch of other things that we're doing, but those are the main things. I wanted to say, if anyone's interested in joining the BC Healthy Built Environment Alliance for those presentations that we do every 3 months, please give me a call, and I can definitely add you to that invitation list and to receive the e-news that we put out. It's important to mention that the Linkages Toolkit is a foundational resource for us, but it's not the only resource for sure related to built environments. There's a whole bunch of other practice documents and guides, training opportunities, training curriculums put out by others. This is just a sample. And the ones in blue are available through the BC Centre for Disease Control website. So you can see, if you're interested in learning more about the Healthy Built Environment teams at the regional health authorities, there's a report there about that. We did a report on health equity in the built environment, and a bunch of other things that you can check out. And if you have trouble getting those, or if you're interested in anything else, just please feel free to give me a ring anytime. And I'm sure I put my email address somewhere in this presentation, but I will make sure that you get that.
Okay, thanks, Charito. So we just had one question that came in from the audience. Poverty reduction strategies and/or tobacco cessation reduction as future considerations for practice or layers within the toolkit, or are they concluded within social well-being?
Poverty reduction and tobacco cessation.
Yeah. Or would they fit better in the separate social well-being toolkit?
I feel like those might be two separate, might be dealt with separately.
Right.
I'm curious to know more about that question. I wonder if we can maybe put it to the discussion part when people can. Yeah, tobacco cessation, it's more of a healthy living activity. So like healthy built environments sort of nudge people to choose healthier lifestyle choices. So that could be included as a health outcome. We haven't included that in research, so that's an interesting suggestion that I'll note, especially when we talk about the equity lens. That I know that smoking, the traditional cessation strategies haven't worked for marginalized populations as well as the general population. So that would be an interesting equity lens thing to consider.
Right, because tobacco cessation has more to do with, I guess, where stores are located, or how children might be exposed to stores that might sell tobacco, or the built environment is more about the physical environment that impacts people's behaviors. Right.
Yeah.
Someone's comment came in. We looked at tobacco cessation from the built environment perspective only where stores are located within the community.
Oh, great.
Okay.
Oh, I'd be interested in seeing that. If whoever wrote that could share something.
Yeah, perhaps we could talk more during the discussion portion.
Yeah, thank you.
Thank you. Okay, so first discussion, another one came in. We used the earlier version of this document, assuming the toolkit, to frame our submission to the City and County of Peterborough official plan work. It was invaluable in helping us focus our response. We look forward to applying this newer version and tapping the resources on mental health and social health.
Oh, good. I'm so happy when I hear that it's been useful. I'm very pleased to hear that. Thank you for sharing.
So right now, I'm going to unmute everyone, but please keep your phones on mute if you're not talking. Okay, so let's try this out. So first discussion question. How has this conceptual framework supported your work? Or how could it support your work if this is your first time seeing it? Feel free to speak up or type into the chat box.
Hi, my name is Karen. I'm calling from Ontario. We use the framework actually as an advocacy tool during the election campaign of items that potential mayors and councillors should consider.
Thank you, Karen.
Hi there. My name is Joan. I'm calling in from Alberta Health Services. Our program name is Safe Healthy Environment. So we work with public health inspectors, which I am one. And my specific program is called Healthy Physical Environments. And the one way that this document has really, really helped us establish our own Healthy Built Environment program, which we call Healthy Communities by Design. I just find it very straightforward, and it really gets to the point on what those concepts are that we need to focus on. So we're using it to frame our own program, and also when our health inspectors go out and interface with municipalities on planning issues, we use the 5 pillars. So thank you so much.
Thank you. Awesome. Yes. And just to mention, like, that's exactly what we were hoping, that it's so much work to sift through the literature and pull out those key messages. And what we wanted to do was to do that work for you, so that all you have to do is, reference the toolkit and you know that there's literature behind it. So that's perfect.
So another comment from online, greatly, it has helped to support initial conversations, early engagement with our local governments to help support the development of our relationships with them in community planning. Having said this, once relationships have been established, our local governments are looking for a deeper dive or what's the next thing you can offer. Yeah. And perhaps the social well-being piece and the economic co-benefits piece would be something that would be more to that conversation.
Yeah, it's very much, all the principles in the toolkit are very much aligned with how planners work already. They're just general principles that they work with. So it's sometimes it's not to add, not to change the direction of a plan, but just to add the weight of the health professional voice. There's some credibility there to the health professional saying, yes, this is a good plan. This is how we see it'll benefit the health of the community. That weighs a lot. So I think I wanted to mention there's an excellent resource if people are looking for more detailed stuff that speaks to planners and local governments. Dialogue and the Conference Board of Canada recently put out a well-being design framework, and we can send that out through the discussion forum as well. It's available online, but it's specifically for planners and designers, and it speaks their languages. It aligns with their processes that they use. It even goes into indicators for each element. So I'm super excited about that resource, and I'm hoping that our next our social well-being one will complement that, like sort of be aligned with that one, because I think it's something we've heard in the past is that the Linkages Toolkit is so high level, and that's valuable for its purpose, but some audiences need more detail. So I always talk about that well-being framework as being that something.
Mike says, thank you for the suggestion of the planning document. I think, have we posted it on the forum? I don't remember if we have. Okay. I don't think so. Yeah, okay. Okay, great. And so just a reminder to put your phones on mute when you're not talking. Okay, so another question or another comment came in. The framework is used widely in Newfoundland and has been adopted to inform the work that has been happening at the government level. And another comment, the Newfoundland and Labrador Building Healthy Communities Collaborative has used the information and efforts to create awareness among municipal leaders, community organizations, to show how their efforts influence health and our collaborative planning for future activities.
That's great.
Yeah, that's great.
In case any of you work with French-speaking populations, it might be good to know that the toolkit will be translated into French in the coming months.
Wow.
Yeah, so we've got funding support from Public Health Agency in Canada for that, and I think they said it'll be done before the end of the year, so it should be out pretty shortly.
That's great news. So the toolkit is available on the BCCDC website. We can send you a copy of it, Wendella. Or if you want to just, I will be sharing a link to the forum. It has been launched. I just saw that it's been launched on the NCCH website.
Oh,
yeah.
yay.
So the toolkit is available through the website as well. There's a link there to the BCCDC website. So
That's great.
Perfect, thank you. Yeah, if you could give me the address, that'd be great.
Yeah.
So I'm just typing in now. The forum has been launched, so feel free to take a look after the webinar. So do you have any questions or any more comments for discussion question number 1? Should we move on to the next question? Sure. Okay, so next question. What wishes do you have for the next revision of the HBE Linkages Toolkit?
And this is really to help guide us because it is a living document, so we're wanting to update it and refresh it, keep it current. So if you have anything like, for example, somebody mentioned tobacco links and poverty reduction, things like that you think would be helpful to tie in, that would be really good to know about.
We're just waiting in case people are typing into the chat box.
Oh, sure. Yeah, no rush.
Or if anyone wants to speak up, feel free to do so as well.
I think I'll just concur with the comments on including something on poverty reduction or like the unique needs of vulnerable populations as well in the community, and how we can either acknowledge or address or look for opportunities for participation in the decision-making process for some groups that might be underrepresented, but might have some special needs or who would benefit from being considered in the planning process.
Thank you.
Yes, hi, Kristen here from Brant County Health Unit. I was wondering if there's any consideration for putting links in related to climate change adaptation and resilience, and how that and that piece with respect to the built environment and health outcomes.
Yes, I just attended a sustainability forum in Kelowna this month and came back completely inspired, and I think that's been a missing piece, the link to sustainability. The natural environments feature touches on that. I think it's also we're limited by available research, so the toolkit prioritizes, like it's only a reflection of what's available in research. So we're limited, even if we try to include stuff in our search strategies, it just sometimes doesn't come up, and that's what we found with equity-related terms. It's just not a huge focus sometimes, which is frustrating when we know that it's important to include, and it makes just common sense that there would be health outcomes. So the climate change and the sustainability piece is a particular interest of mine. We are focused for the next phase on the social well-being, social environment priority, but I think after that, I'm going to be looking towards incorporating more messages around sustainability.
Okay, great, thanks.
Yeah.
This is Pepper in Manitoba.
Hi, Pepper.
I'm really looking forward to the next version when you do a bit more of a focus on the social well-being. I focused on using the Healthy Built Environment Framework for my my master's thesis, which was a project that was focused in First Nations. And I found that what was really useful was to try to take that very high level framework and try to operationalize it and how it could be used in strategic planning and for priority setting for community development. So I found it really useful, but I would be interested to hear, how other people are operationalizing the tool. So that might be something to consider, maybe not necessarily in your next version, but maybe as part of a focus for the forum or some other platform where we could see how people are operationalizing the use of the document. Thank you.
Yeah, that would be great. Are you saying, Pepper, like maybe our next discussion we could focus on like a particularly successful way someone has operationalized it as a case study?
Yeah, I think that would be a great approach. Yeah, I'd be really interested to hear how people are using it.
Yeah, for sure.
Are we currently in the process of collecting success stories for the toolkit?
Yeah, I sort of like ad hoc as I hear about things. I have sort of like a Word document on my computer, and I just track it when I hear of stories. But there's so many ways that people are using it that I just don't hear about. But I think if we put out a call, we always get so many stories back. And actually, that's another project that I'm exploring is around how to share stories, not just about using the toolkit, but just like success stories about built environment initiatives in general, and how, especially like for the smaller communities piece, the toolkit has been criticized in the past as being not relevant for smaller, more rural communities, and I really hear that. It is urban focused. So we're playing with the idea of perhaps story sharing as a way that would be more helpful for particularly how built environment solutions have been implemented in rural communities, and being able to share those between communities to inspire and show how things can be addressed differently. So we're trying to figure out about storytelling. What's the best way? How is it, like, who does it work best for? Generally about storytelling as a communication tool. But I like the idea of maybe taking one key way that people have operationalized the toolkit and really focus on that, and then give you all an opportunity to ask questions for people that have used it in their communities, and maybe we could have like an urban example and a rural example, just to show the contrast. But I think that'd be a great discussion.
Thanks. So next question that came in from the audience. I really like the economic co-benefits that was introduced in this version. May I ask if this could go into a deeper dive with more information so we can bring even more co-benefits, more examples, etc., to local governments? I guess, will they be, for next edition, will there be more deeper dives or more exploration of the co-benefits, I guess, other co-benefits, not just economic?
Oh, yeah, absolutely, yeah. And that's what we would love your feedback on. If there's other co-benefits that you particularly are looking for research messages on, please let us know. We do take that seriously. When we hear from our audience that this is a need, that's something that we want to know. So, yeah, if you have suggestions for other co-benefits, I'd love to hear it.
And so next one, would there also be any research done regarding short-term rentals in the housing section? If there's any health evidence for that?
Short-term rentals. I don't remember there being reference to that in the current version. I wonder, could the person that mentioned that say a bit more about what you're needing or what you're thinking there?
Hi, yes. So I had actually asked the question. So with regards to short-term rentals, I know some municipalities are looking to pass regulations around short-term rentals, and I think some already have. And for like a referral that I'm working on right now, for example, there's not a lot of health evidence with regards to for or against short-term rentals. So that was kind of just my ask around that.
Yeah, that's a good question. I'm sorry, we don't have that included as part of our scoping. I'd like to put that out there to others on the line, though. Is anybody else familiar with research or evidence either way for short-term rentals?
Perhaps it's something the NCCH could look into. We could conduct a short, brief literature scan and see if there's anything, Janelle, and then we'll get back to you on that.
That sounds fantastic. Thank you.
Do you have your email, Janelle?
I could email my contact information to Charito.
Okay, sure. Great. Sounds good.
Thank you.
This is Pepper. This is Pepper from Manitoba. I don't know anything so much necessarily about the short-term rentals, but I know that in my project, we expanded the concept of looking at housing to include shelter more generally. So the importance of conceptualizing not just but all different types of housing and shelter. So I don't know if I would have any references that might be of any use for you or not, but it would be interesting to link up to see what kind of work it is that you're doing.
Yeah, thank you.
I would like to suggest that would be a great discussion thread on the forum.
Yeah.
That's exactly what we're hoping is that people, Janelle, feel free to post that more generally on the forum, and then Pepper, you could respond that way so that we can all benefit from your ideas.
Mm-hmm. Okay, so next comment. I would like to see more focus on mental health and substances broadly, and also age-friendly linkages.
Mm-hmm. Yes, the mental health piece is strong and something that relates to the social well-being stuff as well. So that the mental health and built environment fact sheet should be out by the end of this fiscal year, and we're currently going through lit reviews for that with BC Children's Hospital. And then the age-friendly, that's something that I go back and forth with because as I mentioned, the toolkit, it's meant to be very high level. So there's so many ways that you can splice healthy built environments, and we have limited age category specific messages in the toolkit right now, and we don't intentionally pull that out when we do literature reviews just because we are more higher level. But I take that feedback as a need, and I think especially with the growing seniors population that I'm hearing more and more that especially for seniors that we need specific messages for that population. So yeah, I'm starting to think that perhaps that should be more specified in upcoming revisions. I'm curious if that is something that others are finding as well, that you're looking for age-specific messages, not just with seniors, but age-specific.
Mm-hmm. All ages, including youth and children.
Yeah. Okay, I'll note that. Thank you.
And if you want to post your questions in the forum to see if others across the country also have experiences or knowledge around that, feel free to do so as well. Okay, so next one. So Mike says, we use the toolkit as our go-to reference in replying back to community planning referrals, OCPs, master plans, etc., as part of our content for health support for their local government plans.
Oh, good.
Yeah,
I'm glad. That's great.
So Morgan says, coming from the heritage sector, I was pleased to see heritage referenced in the toolkit in the context of placemaking and reinforcing sense of place and shared culture.
Mm.
Could there be further consideration of the heritage health connections in future versions of the toolkit? Mm-hmm. For example, historic neighborhoods tick many of the boxes for complete neighborhoods. Mm-hmm. Also, in many jurisdictions, repurposed historic buildings have been an important source of affordable housing stock.
Oh, that's interesting. Yeah, I haven't heard that term, historic neighborhoods. I'm writing it down. I feel like that's an interesting way to conceive of it. But yes, the answer is yes. For the next social environment framework, we're starting just with a scoping review, so it's just the framework piece for now, and the vision is to then flesh it out as a full toolkit. But for the framework, the placemaking cultural histories like ownership, sense of place, the history of the role of arts and culture, food. All of those things are things that we're considering for the scoping review, and we'll see what the evidence brings forward. But that placemaking piece is so strong around social belonging and reflecting, the local landscape reflects the people and the history and the culture that lives there. So yeah, I love that idea, and yes, I agree that should be an emphasis going forward.
Thanks so much for all the contributions so far. It's been great. I think this discussion portion has been really helpful and really beneficial to add to the presentation piece as well.
Yes.
Yeah.
Yes. And just to say that it's okay to have criticisms as well of the toolkit. Like that's actually very, very valuable to me. If you haven't found it helpful, or if there's something missing, like I really hear that we need to do better for rural communities, and also that it's so high level that sometimes that it doesn't meet the needs of specific more experienced planners and developers and the partnerships that you have with them. You need something more. So please let us know about critical feedback as well.
So we have about 10 minutes left. Maybe we'll go on to the next slide. I just wanted to talk a little bit about the forum. Forum is launched. I included a link in a chat box maybe a couple of screens ago. I don't know if you scroll back, but here's the link to the forum. So this is just a screenshot of the forum from about a couple of weeks ago. So you can register for an account on the forum, and once you're approved for a membership, then you can post, content, information, or questions in the forum for others to answer, or to share your resources and whatnot. Oh, so another question came in. I'm not sure if this would also be a good ask, but perhaps would there be anything that could be added around the opioid response and how it relates to supported housing, other links to the environment, etc.?
I have to think about that.
Yeah.
The thing that I think about is community-based response. So in my mind, it relates to community belonging and how well-equipped communities are to supporting the most vulnerable residents. Some things, like the toolkit, is mainly focused on partnerships with local governments and the realm of influence that local governments have. So that's part of what we look to when we're considering new content, is what's within the scope of local governments. I'll have to think about that more. I mean, that's a thing that I don't know a lot about,
right,
the opioid crisis.
Yeah.
And then so I'm not clear in my mind. I haven't thought through how Built Environment might interact. I'm very curious if there's thoughts, and perhaps that could be an upcoming discussion as well, because I haven't put my mind to that. But if there's thoughts from others, would love to hear
it. This is Mark Tyndall here. There is a lot of discussion at the housing level about how to make places less dangerous for people who are using drugs. And I agree, technically that does definitely fall into a healthy built environment type of dialogue. So yeah, whether it becomes part of a consideration overall, I think it's with the current crisis and the profile it has, I do think it deserves sort of a specific call out, and there are best practices and models that are being developed about how to create a safer environment for people who use drugs in housing.
Thanks, Mark. Maybe that's something that you can help us talk about more at an upcoming discussion. It's kind of a new area. Yeah.
The next comment came in a recent call from our city for input on the city's master plan, we have responded using information from all 5 pillars. Great, another success story. Yeah.
Awesome.
Yeah.
Love to hear it.
Yeah. Okay, so and Mike also mentioned from a community planning perspective, supporting the upstream planning with community to avoid downstream impacts. Yeah, definitely. Okay, so just moving on to the next slide. Charito, could you go to the next slide? Sure. Yeah. So I added just a little bit more slides about the forum. So the forum membership is free, and we will feature monthly live webinars such as this one and discussions for knowledge sharing, which are archived online. So I think our January webinar will be on health equity and the built environment, and we're also planning a social isolation in the built environment webinar sometime in the future. And anyone with an interest in the healthy built environments can join, including public health planners, local governments, researchers, policymakers, and industry. So we have been looking for champions for the forum for the last month or so. We have recruited quite a few across the country. Thank you for joining the forum. And so if you're interested in becoming a champion or just a participant, feel free to take a look at the forum. Next slide, please, Charito. So next question for our discussion. We have about 5 minutes left. I guess because most of you haven't had a chance to look at the forum, so maybe I will save this question for the evaluation survey once you've had a chance to look at the forum and think about how that might support your work. So does anyone want to speak up about how you think the forum might support your work, or how you want it to support your work? The forum was organized based on the 5 pillars from the HBE Linkages Toolkit. So Mike says evidence-informed practice and resources, sharing information from partners and communities. Yeah, definitely. That's one of the goals for sure, what we want to achieve in the forum.
This is Graham from Alberta Health Services. I work with a variety. Hi, I work with a variety of different communities throughout the province, especially rural communities. I'm hoping to use the forum as a way to spread information as a kind of a communities of practice, so they can share their stories and successes and challenges and how they've overcome them, as well as resources that'll be effective for the work that they do.
Great, yeah, definitely. Good to hear. Okay, and if you have any more comments and questions about Charito's presentation or the toolkit, feel free to bring them up as well. We have about 2 minutes left.
Well, now that the forum's live, I wanted to also suggest that you could share it with others that it may or may not necessarily want to be forum champions, but would be interested in participating. So now's the time to spread the word, and we're hoping that, as this pilot year goes forward, that we'll be able to continually improve it. So it's an open invitation for feedback as we move forward, that if you think something is working particularly well, or if something could be improved, just feel free to let us know.
Do you have more questions from people about the presentation or about the forum, about anything?
So I hope that my email address is available to you. If it's not, I'll send it out through the discussion forum.
I'll type it in.
Thanks, Tina. So feel free to contact me afterwards as well. And the Healthy Built Environment Linkages Toolkit is on the resources section of the forum, so you'll be able to see it there.
And the recording of this webinar will be recorded or will be posted on the forum under the monthly webinar sub-forum section. If you have more questions, feel free to respond to the posting and continue discussions there. Okay, thank you very much, everyone, for joining. It was great. It's really good to hear from everyone about their usage of the toolkit and how it has been successful in their jurisdiction.
Yes, thanks, everyone. It was such a pleasure to talk to you this morning and to hear about how you've been using the toolkit. Thanks so much for sharing. and we'll look forward to the next